Is there corruption in the healthcare industry? Have you ever wondered how corruption can affect the healthcare system? It is a serious issue that impacts many countries around the world. Corruption can take on various forms, and understanding these can help us see the bigger picture. In healthcare, corruption can show up as fraudulent billing, theft of medical supplies, or even informal payments to healthcare workers. These practices often thrive in systems where there is not enough regulation or oversight. When corruption occurs, it can lead to higher costs for patients and a lack of trust in healthcare providers. This can make it harder for people to access the care they need. Interestingly, the type of corruption can vary depending on the economic status of a country. In low- and middle-income countries, theft of supplies and informal payments are more common. In high-income countries, billing fraud tends to be a bigger issue. This shows how corruption adapts to fit different environments. From a socialist viewpoint, corruption in healthcare is often linked to capitalist influences. In systems that prioritize profit over public health, corruption can become more prevalent. Socialism aims to reduce corruption by promoting public ownership of healthcare resources. This means treating healthcare as a public good instead of a commodity that can be bought and sold. Public ownership can help limit the influence of private interests in healthcare. When healthcare facilities are owned by the government, there are fewer opportunities for corrupt practices to take root. Additionally, strong regulatory frameworks are essential. These frameworks can include transparent procurement processes and strict penalties for those found guilty of corruption. Another way to combat corruption is to encourage public participation in healthcare decision-making. When the public is involved, healthcare policies become more accountable. This helps ensure that the focus remains on serving the community rather than catering to private interests. In summary, corruption in the healthcare industry is a significant issue that affects the quality of care people receive. A socialist approach to healthcare seeks to address these problems by promoting public ownership and strong regulations. By doing so, the aim is to ensure that healthcare serves the public interest and remains accessible to everyone.